I needed your expertise in MR imaging and treatment, and you needed a urologist to help you. I think this is where Tulsa, with the use of MR and imaging and technique and the urethra, where it is important, right, I think was an important method for us to collaborate and get patients the best care possible.
And you're exactly right. What would interest me as the second Tulsa physician in the United States is I always respected you because of I'd seen lectures on videos of you talking about preservation of sexual function and preservation of urinary function, no diapers, no pads, if we can prevent that. And I believed what you were saying was right. I also believe what you were right. Could you keep the patient going for years and years before you had to maybe commit to whole gland radiation or whole pelvic radiation? I thought all those beliefs were correct because I'd seen that in practice. And then when I started doing Tulsa, I was warned by some of the physicians that trained me in Europe that you're going to need a good urologist. Well, what bothered me is I didn't feel like I had a urologist, except in the back of my mind, except you, that understood thermal energy and what it does to the urethra and what it does to the prostate. And obviously, you're going to get thermal injuries if you do enough of them long enough, or what happens. And so here's Dr. Kassabian in Atlanta, and as you know, you've seen some of my patients from around the United States. I've convinced them that you really need to see a physician that understands what he's looking at in the urinary tract, in the cystoscope, compared to just the daily urologist. I think there's a big difference. Just like you want somebody like me that looks at prostates every day on MRI. And so I thought this was a great match. I mean, and you have been very helpful to our practice.